What is going on, everybody? Happy Monday. Today we're going to be veering off a little bit differently. We're not necessarily doing clinical review or pharmacology review, but instead what I want to do today is talk a little bit about the patient experience. Now, this is especially important for those of you who are either thinking about having your own practice and or have your own practice, because at the end of the day, you have a business, right? And in order to make your business thrive, you need to have great customer satisfaction. And in this case, your patient is the customer. Now, even if you're not in the process of owning your own business, or even if you don't have your own business, your own practice, this still applies because you still have somebody that is looking at you, right? They're looking at productivity. They're looking at how well you interact with your patients. So today we're going to be talking about some things that I think are very important when it comes to the patient experience, because lots and lots of clinicians actually aren't very good at this aspect of the job. They're very good at diagnosing. They're very good at writing scripts, but they're not so good at the one-on-one interaction between the patient and the provider, right? This is very important. Building a relationship, instilling trust, confidence. These are all things that are going to play out when dealing with the patient. So I'm going to talk about some important principles that I feel are important in order to make that experience better for your patient. So the very first thing that I want to talk about is confidence. Now, we'll get into this a little bit later, but the first point of interaction between you and the patient is when the relationship begins, right? And the first thing they see, like they say, right? First impressions are everything. And yes, for the most part, first impressions are very, very important. So it's very important that as soon as you open the door, you walk in with confidence. As soon as you open the door, you need to have eye contact. You need to walk in like you own the room. You need to walk in, shake your hand, introduce, and sit down. Very, very important. Your body language says a lot about you. The way you speak and communicate says a lot about you. The way you enunciate your words, your sentence structure says a lot about you, right? If you're walking in hunched over with a coat that's wrinkled, that's dirty, this says a lot about you. If you aren't groomed, this says a lot about you. Now, I'm not here to say what's right and what's wrong, but the reality is people do make judgments about, based on appearance, based on grooming. So those are very important things to keep in mind. Your body language is another one that's very important, right? You need to walk in like you know what you are doing, like you're there to help. So when you shake a hand, it needs to be a firm handshake. These are things that are very important. Don't slouch, shoulders slumped over like this, head down, looking at the ground when you speak. If you're sitting, you need to sit down, chest up. You need to look at the patient. You need to shake their hands. You need to be assertive. These are very important things, right? They need to know that you're there to help. This doesn't mean that you have to have all of the answers in regards to their diagnosis and their treatment plan on hand. This doesn't mean that you need to make things up in order to look superior to the patient, right? I'm not talking about making things up, and I'm not talking about fibbing or lying. I'm talking about your presentation. Right? So that's very, very important. Now, like most clinics, they're busy. It doesn't really matter where you work. If you work in a hospital, if you work in a clinic, urgent care, emergency room, it doesn't matter. These places are busy. And what happens when you're busy? You have people waiting. And sometimes the patients wait longer than they intended to. Sometimes they have an appointment at 1 and they're not seen until 1:30. This happens. You have to apologize for the wait. I know it's not your fault. I know you're not the person that made the schedule. I know you had a complicated case 30 minutes prior. I know that there was somebody that was a little bit more critical right before this patient, and this patient is simply here for a URI. However, it's still their time. It's still important that you validate what they're going through, that you validate their concerns, that you listen, that you're empathetic, and you apologize for the wait, even if it's not your fault. Right? Even if it's not your fault, you apologize. You will be surprised. You'd be surprised how many times I've diffused the situation by simply acknowledging the fact that they waited, by being empathetic and by apologizing. Because if you're this nice and understanding, it doesn't fuel the fire of anger. And lots of times people get angry and upset because they want you to feel like you know what they're going through. Give it to them. It's fine. It's not a big deal, right? Apologize and move on. All right, so now you're in the room with the patient. What do you do next? Here's where everybody goes wrong. 90% of people. 10% of you do it right. 90% do this wrong. Walk in the room. You sit down. Very important, sit down. There's been multiple studies that show that the patient feels like they have a longer visit with the provider if the provider is sitting down. If you stand up, they feel more rushed. So you sit down. You don't need a pen and paper. I promise you don't need to write anything down. You don't need a laptop in front of you. You can have a conversation with your patient without writing notes. This is a skill, but you can do it. I promise. Ask them why they came into the office, what the reason for their visit is, what is their chief complaint, and let them talk. Don't interrupt. Don't say anything. The vast majority of providers, clinicians are going to interrupt within the first 10 seconds, 15 seconds, because they have an agenda in mind. They have a list of questions. They have this laundry list and they want to go boom, boom, boom. But guess what? If you just let the patient talk, the far majority of patients don't have much to say about their complaint that's over a minute. A minute is a long time if you actually allow them to vocalize and verbalize what they are going through. Let them talk. Now, obviously, there's going to be exceptions, and I've had patients, especially the older patients, 60, 65 years of age, who can go on forever. So if you've reached the minute and a half mark, and you feel like you're not going anywhere, okay, you need to interject. But the vast majority, I promise you, you'll get the full scoop after a minute. And here's the trick. After you allow them to talk for the minute, and you see that they're winding down, now it's time to do the exam. And if you're really good, if you've been doing this for a little while, then you can even do your ROS as you're going through the physical exam. Obviously, sometimes you're not going to be able to do it simultaneously. For example, if you're auscultating, you're not going to be asking questions at the same time. However, you can ask questions about, do you have any chest pain, palpitations, things of that nature, and then you can go ahead and auscultate the heart, right? So if you kind of do it simultaneously, this also saves you time. And you've already sat down with the patient. They feel like they were heard. They feel like everything they wanted to address has been addressed. Remember, guys, patients are people. Talk to them like they're a person. Talk to them like you know them, like they're a friend, a distant cousin that you haven't seen in a very long time. Talk to them in layman's terms. Forget the medical jargon. Forget the algorithm. Forget the protocol. Talk to them like they're people. At the end of the day, the patient has the right to make a decision. At the end of the day, it's your patient's choice whether they want to pursue treatment, whether they want a referral, whatever it may be. It's their life and it's their decision. Your job as a provider is to simply give them all of the information, is to educate them on what the plan can be, what their options are, and maybe the risks and benefits of either going for it or not going for it. You're not here to make a decision for them. You're here to give them information. Treat them like people, treat them like they have an opinion, and most importantly, treat patients like they're smart. Very, very oftentimes, clinicians have this complex where they are the end all and be all above their patients, and it shouldn't be that way. This is a joint decision making. You need to give them the information, and they can go ahead and make their decision based on what you provide for them. Talk to them. Listen to them. If you're going to give a suggestion, say it with confidence. Don't give a half-assed suggestion, right? Go all in with your opinion. If they ask for it and say, what would you do? Very clearly state what you would do. If you have an opinion. Sometimes you don't. Sometimes you're on the fence. Sometimes you don't feel comfortable. But if you are going to give a suggestion, if you are going down that route, make sure that you're confident with the suggestion. Make sure you're all in with the suggestion. This is very powerful for your patients. Now, at the end of the encounter, recap your entire visit. Yes, even just talking about acute bronchitis, for example, it's very routine, it's very mundane, and although you may see it all the time, multiple times a day, guess what? Patients don't have acute bronchitis on a regular basis. They might not know that their cough is going to take 3 weeks to subside. They might not know that they need to take the medication on, two on the first day and then one every other day if we're giving a Z-Pak for bacterial bronchitis because we have some other type like pertussis of some nature, right? Maybe we don't have viral. Maybe they don't know how to dose their ibuprofen. Yes, it's written on the prescription. Maybe they don't know that sometimes patients, they get scared. Oh my God, my cough is still there after a couple of days. This is normal, right? Summarize the entire visit. Tell them what they have, tell them their diagnosis, tell them the treatment options. If they're worried about, lots of people will come in with a preconceived notion of what they have. I have pneumonia. I know I have pneumonia. Calm, reassure them. You don't have pneumonia. This is acute bronchitis. This is most likely viral in nature. It's only been a few days. If you want to give them some kind of an antitussive, give them an antitussive. Take 2 teaspoons every 6 hours. And then if it doesn't improve after the next week or so, come back in. If you have chest pain, shortness of breath, come back in. If you start to have hemoptysis, come back in or go to the ER precautions, right? Make it very clear. After you summarize the entire visit, ask if they have questions. You'd be surprised how many times they're still, sometimes they are unclear as to what the objective is, regardless of how good you feel you've done. Because I know there have been times where I feel like I've summarized everything, I've explained everything, and then they ask the nurse a question, and the nurse doesn't have the answer, so she comes back to me. So it's very important that before you leave, and although you feel like you've recapped, do you have any questions before I leave? Was everything clear? Can I help in anything else? The majority of times you're going to say no. Sometimes they will have very important questions. Sometimes they misunderstood altogether. This is the time to clarify. Now, I know I've said a lot of things. That you might feel are going to be tedious and things that are going to take a very, very long time. But I promise you, if you get better at these things, if you get better at communicating with people, you'll be surprised at how fast you can make these visits. You'll be surprised not only how fast you can make these visits, but how long your patients will actually think you've spent time with them. So it's not necessarily the duration that you're with them, it's the quality of time that you've actually spent with them. Did you hear them? Are you empathetic? Did you answer all their questions? Did you, maybe alleviate some of their concerns? Cancer is a big one. Patients come in all the time thinking they have cancer, thinking they have a brain tumor because they have a migraine, right? So it's very important that you calm these worries down. Recap, walk in with confidence, build a relationship with your patients. And listen, you're not going to be able to get to everything in one visit. Lots of times when you have the elderly patients, the senior citizens, they have a host of complaints and you can't get to everything in one visit. Tackle what you can and say, hey, the next visit, please come back in and we'll address those issues then. Because at the end of the day, you have time constraints. At the end of the day, whether it's your business or not, you have productivity to meet. You have other patients to see. And if you work in family practice, 80% of these patients aren't going to have any type of urgent complaints. So it's very easy to say, okay, we've handled your diabetes, we've handled your hypertension, let's handle your hyperlipidemia at the next visit. Although you could probably handle everything at the same time, but just to make a case for my argument here. So anyway, I hope this was helpful. Just remember, you're not dealing with diseases, you're dealing with people. And at the end of the day, that's what's important. They want to know that you care. They want to know that you're going to do everything in your power to make them better. So that's it. That's it for today's video, today's lecture. If you've been listening on the podcast, I'd really, really appreciate a rating or review. This really, really helps get the show out there. This helps us climb the rankings, I should say, so that more and more people can find us. If you're watching this on YouTube, please subscribe, please like. This also helps us climb the ranks as well. If you guys have any questions for me, you can always DM me on my personal Instagram, which is AND_REID. You can DM the PA Boards Instagram, PABOARDS, or you can email me at andrew@physicianassistantboards.com. Thank you guys so much for listening, and I'll check you on the next YouTube and or podcast. Take care, guys. Bye.